So thank you, Dr. Lynch, for being here today. We're really excited to have you. We've got a lot of buzz going on with PRP and plasma therapies, so we'd like to ask you some questions about it, okay?
Okay.
So first of all, what is PRP?
PRP stands for Platelet Rich Plasma, and that just means that we take the patient's blood, and usually it's just 1 or 2 tubes of blood, not very much, and we put it into a special tube that separates the plasma from the rest of the blood products. The red blood cells, white blood cells are filtered out, and we get a concentration of platelets inside that plasma. We can then take the plasma and put it back into the patient in an area that needs to be treated.
So where can it be used?
So since platelets are full, and the platelet-rich plasma is full of growth factors, it stimulates healing and growth and regeneration of tissue. And so we can use it in any area that has got deteriorated tissue, damaged tissue. So some of the more popular areas are for joints to heal and to heal injuries related to sports, such as tears of muscles and tendons. It's very popular in the aesthetic community for regenerating facial volume, and so helping to stimulate collagen regeneration. We can use it underneath the eyes to help with dark circles and puffiness. And then some really popular areas are hair regeneration and even for erectile dysfunction in men.
Are there any restrictions?
The main thing that you have to worry about is any use of anti-inflammatories before or after the procedure. Anti-inflammatories are going to stop the activity of the platelets, or at least slow it down. And so you'll get less of a result if you're using anything like ibuprofen, Motrin, aspirin. And so that would be something to stop if possible for about a week to 2 weeks before the procedure, and anywhere from 2 weeks to 6 weeks after the procedure for the best results.
I see. Are there any patients that should not that you would not recommend this sort of therapy?
Because you're using your own blood and your own blood products, there's no risk of interaction, and there's very little risk of any other adverse reaction across different age groups and even different medical conditions. So there are very few, if any, medical conditions that we would say you would not be a good candidate for this procedure.
How long does it last?
So the procedure itself only takes a few minutes, and then the platelets start to work right away and continue to work over 4 to 6 weeks. For most procedures, you're going to want to do more than one. It's often recommended to do a series of 3, sometimes more, depending on the area, to get the best result. And you'll continue to see those results build over weeks to months. For most cases, we recommend touch-up treatments every 6 months for maintenance.
Got it. And so 3 procedures over, a year timeline, maybe once a quarter?
Yeah, so generally we'll recommend for the initial therapy to do those first 3 treatments about 2 to 4 weeks apart.
Okay.
And then after that, waiting about 6 months to do a touch-up or a maintenance treatment. And at that point, it's typically only 1 required for maintenance. You don't have to do another series of 3. But each procedure area has a slightly different protocol with it.
Can this replace surgery?
It depends on the circumstances. In a lot of cases, yes. But for someone who has a very advanced osteoarthritis, for instance, who might be looking at a knee replacement surgery, the PRP is not going to be able to regenerate enough tissue to do the same thing that a knee replacement surgery would. However, it can reduce the inflammation in the area, it can stimulate healing and growth in the area, and so it almost acts more like an anti-inflammatory shot at that point. It would be a good alternative to a steroid shot in someone who's trying to prolong having surgery.
I see. Does it help with pain?
So part of what the platelets release are different factors that reduce the perception of pain in the area. And there are actually some studies that show that change is a permanent change in that area.
So thank you so much for being here today and sharing your knowledge. We're really excited about your upcoming training series. We can't wait. Thanks again.